any mother can tell you, can be an excruciating experience.
Come on, Kelly, push hard.
Almost.
Ozzie Chavez knows something about that pain. She's experienced it 5 times.
How hungry is everyone?
Very, very.
When Chavez went to the hospital to deliver her 5th child last summer, she expected to get the same treatment she'd received when giving birth to her other children. So when the pain became excruciating, she told the nurse she was ready for the anesthesia known as an epidural block. The nurse went out to inform the anesthesiologist. Then
she came back instead with a message of, that'll be $400. And originally we said, okay, go ahead, bill us. That's what we thought. And she said, no, you don't understand. It's cash. We need the cash.
You couldn't pay by check?
They wouldn't let us, no.
Couldn't pay by credit card?
No.
Chavez never got the epidural. During her ordeal at Northridge Hospital, Chavez's husband was out of work, so they'd lost their private insurance. They were on California's public assistance Medicaid plan known as Medi-Cal.
I thought I was covered. I thought Medi-Cal took care of all of that stuff. But obviously it didn't.
In fact, Medi-Cal does reimburse for epidurals, but at a lower rate than private insurance. Medi-Cal pays doctors about $60 for the initial insertion of the catheter into the spine, versus as much as $300 under private coverage. And epidurals can take a lot of time, because the anesthesiologist must then monitor the patient until delivery, which can take hours. The Medicaid rates for that monitoring period are also lower. Dr. David Birnbach is president of the Society for Obstetric Anesthesia and Perinatology.
And that reimbursement in some cities and some states is very, very low. So low that some anesthesiologists feel that they can't afford to provide anesthesia because it's costing them money for every anesthetic that they do.
Nevertheless, Birnbach's organization strongly condemns what allegedly happened to Ozzie Chavez.
Tell a patient, I will not provide pain relief to you unless you pay me in cash right now is morally reprehensible and should not ever be tolerated.
It may also be illegal.
Okay, Medi-Cal law does not allow for Medi-Cal providers to bill Medi-Cal beneficiaries for services that are provided by the program, so it's an illegal activity if indeed it occurred.
Chavez is suing the hospital and the anesthesiologist, Dr. Lori Burke, who has declined comment. But in papers obtained by ABC News, Burke admits she refused to give epidurals to 6 other women who could not pay in cash. Northridge Hospital did not return our calls, but reportedly is no longer allowing anesthesiologists to deny this care to Medi-Cal patients. Since the Chavez case made news, dozens of other women from around the state have come forward claiming the same thing happened to them. Nakia Johnson, for one, who gave birth without an epidural last month at a hospital affiliated with Northridge. She says she was asked to pay $500 in cash.
I never seen the anesthesiologist. He never made it into my room. The nurses said, if you don't have the money, if you don't have the cash, we cannot even call him for him to come in.
And Dr. Birnbach received a letter from a North Carolina doctor who was concerned that a hospital there had a policy of asking patients in labor if they'd paid upfront money for epidurals. If not, quote, the physician has to have a medically emergent reason for the epidural to be placed.
Historically, analgesia for labor was considered a luxury. It wasn't considered a necessity. And as our philosophy has changed in this country, our reimbursement hasn't.
There's a good reason for that. There's tremendous pressure to keep costs down, whether it's tax-supported Medicaid or profit-supported managed care. The result? A system in which the amount of reimbursement may dictate the kind of care you get.
Most healthcare providers strive to do that. There are others that engage in different levels of care, selective provision of care, and sometimes shocking discrimination against patients who are publicly insured, are in managed care plans, or are uninsured.
Even so, the economic pressures on hospitals and doctors are very real. For example, one of the largest private insurers in California pays $668 for an appendectomy, while Medi-Cal pays only $320. For a mammogram, the insurer pays $68, Medi-Cal $48. Some private practice physicians, like eye surgeon James Knapp, are giving up their practice because of the economic squeeze.
I've been in practice 31 years, and conceivably I could practice another 10 years or so and still maintain steady hands, but I can't do it.
Knapp blames managed care, which has capped reimbursements for patients at $14 a month, with no compensation if cataract surgery is required. Meanwhile, his overhead is not going down.
Well over $8,000 a month. And at $14 a month for patients that I see, it doesn't add up to be enough to allow me to take extra home.
Frustrated physicians, frustrated patients. Some public health officials say it adds up to an unfair, uncaring mess.
Of course, this all reflects what I would call the unique madness of this country. Every other country in the world, every other country, particularly those that resemble us most, have put this into their past by establishing a national health insurance. For ideological, anti-government, anti-tax reasons, we've staved it off to our great peril and invite these kinds of abuses.
I believe very strongly that physicians, like nurses, should be protected from the extremes of the market by receiving most of their pay in the form of a salary that is not dependent on how much or how little they do.
Meanwhile, Ozzie Chavez is about to have her 6th baby. She says she won't be going back to Northridge. But can you be guaranteed that you'll get an epidural wherever you go?
I have private insurance now.
This is Judy Muller for Nightline in Los Angeles.
So what do these horror stories in California tell us about the future of your health care? In a moment, a leading obstetric anesthesiologist, a health insurance specialist, and a consumer advocate concerned about the lack of